You found the person you want to spend your life with. You have planned the wedding, the venue, the dress, the suit, the guest list, the honeymoon. And somewhere in all of that planning, nobody sat you down and said, before you do any of this, you need to go to a laboratory. Because here's the truth that most couples discover too late. Love is not enough to protect your children from a genetic disorder you did not know you carried. Love is not enough to treat HIV that was never diagnosed. Love is not enough to reverse organ damage from hepatitis B that could have been prevented with a vaccine. The tests I'm going to walk you through today are not about distrust. They are not about fear. They're about starting a life together with the most important resource two people can have, and that is the truth. Okay, real quick before we start, I checked my analytics and 98% of you are watching without subscribing. Of course, you know who you are. I would like to ask you to hit the subscribe button, tap the bell, and drop a comment telling me what topic you want me to cover next. I read every single one of your comments. If you're done with that, that is good, perfect, thank you. I'm Dr. Libeya Bethwell, your pharmacist, and what makes today's video different from every other premarital test video you've seen is that I'm not just going to list the test. I'm going to tell you what each result actually means and exactly what to do with it, because that is the part nobody ever explains. Test number one is blood group and what I call rhesus factor, or what is known as rhesus factor. Now, this is the first test and is one of the tests that most couples completely underestimate. Now, know your blood group before you say I do, and know your rhesus factor, or what you call RH factor. Now, if a woman is rhesus negative and the man is rhesus positive, there could be complications during pregnancy that require medical management. Here's what this means in plain language, or in layman's language. If you are rhesus negative and your baby inherits the father's rhesus positive blood, your immune system may recognize the baby's blood as foreign and begin producing antibodies against it. This is called rhesus incompatibility. Now, in a first pregnancy, it is usually manageable, but in subsequent pregnancies, those antibodies can attack the baby's red blood cells, causing severe anemia. Also, it may cause jaundice, brain damage, or even stillbirth. And here's what to do with these results once you're done with the test. If you are rhesus negative, tell every antenatal care provider from the first visit. An injection called anti-D immunoglobulin given at specific points in pregnancy prevents sensitization, and this is a completely manageable situation, but only if you know about it before your second pregnancy, not after your second pregnancy. Test number two is HIV test. Now, this is for both partners, no exceptions. It's for both partners, no exceptions. Now, HIV antibody examination is a fundamental component of any premarital health check. Every detection can avoid transmission of disease to partners and future generations. Now, HIV is still the leading infections cause of maternal death globally, and a significant number of people living with HIV do not know their status. So what do you do with this result? If one or both partners test positive, this is not the end of the relationship, and it is not the end of the possibility of children. Now, people living with HIV on antiretroviral therapy, they live full, healthy lives. With proper management, an HIV positive mother can deliver an HIV negative baby, but all of this requires knowing early and starting treatment properly. If both partners test negative, this is the moment to discuss how you will stay that way within your marriage. Test number three is hepatitis B and hepatitis C test. Now, premarital screening identifies the presence of the hepatitis B virus in either partner, which is essential for preventing future transmission to a spouse or children. Now, hepatitis B is relatively common and vaccines are available. Hepatitis B is the leading cause of liver cancer and, of course, cirrhosis globally. it is transmitted through blood, through sexual contact, and from mother to baby during childbirth. So once you've done this test, what do you do, or how do you handle the results? If one partner tests positive, the other partner should be vaccinated immediately, if not already immune. The positive partner needs to see a hepatologist and begin monitoring, and if indicated, antiviral treatment. Now, if a positive mother delivers without intervention, there is a high risk of transmitting the virus to the baby. Now, with proper management, including giving the baby the hepatitis B vaccine and immunoglobulin at birth, that risk drops to under 5%. Hepatitis C has no vaccine, but it is curable with modern antiviral treatment. Knowing you have it before pregnancy allows treatment before conception. Now, test number 4 is sickle cell disease and thalassemia screening. Now, this is the one with the highest stakes for African couples specifically. Thalassemia is a genetic blood disorder that affects hemoglobin production. When both partners are carriers, there is a 25% chance in each pregnancy that the child will inherit the disease. Now, screening for thalassemia traits is crucial before marriage. The same principle applies to sickle cell disease, which has an even higher prevalence across Sub-Saharan Africa. Now, being a carrier, having the sickle cell trait does not make you sick. You can live a completely normal life without knowing you carry it. But if both partners are carriers, each pregnancy carries a 25% chance of producing a child with full sickle cell disease. Now, lifelong, painful, life-shortening condition, that is. So what do you do with this result? If both partners are carriers, this requires genetic counseling, not to tell you whether to marry or not, that is your decision to make, but to walk you through what it means for your children, what your options are, and what modern medicine can offer, including pre-implantation genetic testing during what we call in vitro fertilization for couples who choose that path. Knowledge changes your options, ignorance removes them. Test number 5 is blood sugar and blood pressure. Now, chronic conditions like diabetes and hypertension may not be visible but can affect lifestyle and fertility. Now, undiagnosed type 2 diabetes and hypertension are extraordinarily common, and both conditions can silently damage organs for years before symptoms appear. In pregnancy specifically, uncontrolled diabetes dramatically increases the risk of miscarriage. It also increases the risk of birth defects, macrosomia, which is a dangerously large baby, and complications during delivery. Uncontrolled hypertension in pregnancy can develop into what we call preeclampsia, which is a life-threatening condition for both mother and baby. So what do you do with this result? If prediabetes or diabetes is detected, lifestyle changes and medication can bring blood sugar under control before conception. If hypertension is found, it can be treated, monitored, and also managed appropriately throughout pregnancy. Finding these conditions before pregnancy gives your medical team the opportunity to optimize your health before the highest risk period begins. Test number 6 is fertility and hormonal tests. Now, this conversation is becoming increasingly important as couples marry later. Essential fertility checks include thyroid function, which is called TSH, or anti-Mullerian hormone AMH, which reflects ovarian reserve. We have ALH, FSH, and prolactin. Now, for women, a pelvic ultrasound can detect fibroids, can also detect ovarian issues and signs of endometriosis. AMH is particularly powerful. It tells a woman approximately how many eggs she has remaining. This does not predict whether she can get pregnant naturally, but it provides critical information for family planning. A woman with low ovarian reserve who knows this before marriage can make informed decisions about timing. A woman who discovers this at, let's say, 38, after years of trying, has far fewer options. For men, a semen analysis checks sperm count, motility, and morphology. Male factor infertility accounts for approximately 50% of all infertility cases, and yet it is the test couples are most reluctant to do. The discomfort of finding out is always less painful than finding out years later when options have narrowed. What then do you do with the results from this test? If concerns are identified, early referral to a fertility specialist gives couples the maximum number of options and the most time to make considered decisions if they're done early. And let me bring this together as I come to a close of this particular video. Now, these tests are not about finding reasons not to get married. Far from it. They're about starting your marriage with the most powerful foundation two people can build. That is honest information about each other's health. Marriage is not ruled out because of a partner's poor health. What matters is that the couple can decide with full information whether to start a family and how to plan for it. Now, every result on this list has a response, a management plan, a treatment option, and a way forward, but only if you know. Do this test before the wedding, not after the first pregnancy complication, not after years of trying to conceive, but before the wedding. Share this video with every engaged couple that you know. Tag them, send it to them directly, because this information in the hands of a couple before marriage can change the trajectory of an entire family. Drop a comment below which of these tests surprised you the most. I want to know, and please subscribe if you have not already done so. Tap the bell and see you in the next video.